I spoke with Professor Ronald Lee about China's population dilemma and the role of the one-child policy.
China's one-child policy was not the decisive factor in this great fertility decline in China. The fertility decline in China doesn't look that different from what happened in Japan or South Korea or Taiwan. They all had rapid and deep fertility declines, and Korea and Taiwan both ended up close to 1 or even below 1 in some years. So no, nothing unusual about it, and it's not just due to policy, it's mainly due to getting richer, getting higher education, socioeconomic development in general.
So that being said, how much of a reliance is there on government programs, and what do you make of the Chinese government's efforts to better accommodate the aging population and to address this issue they're seeing?
Older people are consuming just about as much as younger adults, even though younger adults are earning a great deal and older people are earning almost nothing. So the Chinese system of redistributing income from earners to elderly consumers is working very well. Social spending is now about 10% of GDP, and that's going to triple by 2060. Over the next 40 years. That will triple according to the UN medium fertility projections, which expect that Chinese fertility will rise from 1.6 to 1.8. If fertility remains at 1.6, then that spending is going to quadruple. And that's without any improvements over current levels. Older people are getting healthier fast. That's happened around the world. There is absolutely no reason for retirement to be so early as it is today, certainly in China. And we need to increase labor supply at older ages, push back the age at retirement as life expectancy rises and as health of the elderly improves. And in my view, for the pension program, for example, which is the most important one in this regard, in my view, the best thing would be to make those adjustments automatic in the programs today so that everyone, the whole population, understands that retirement age is going to be rising as life expectancy rises, so that these adjustments are automatic, and then they're not a big socio-political crisis when they're needed.
Would you say caring and housing the elderly in China, is that changing at all? Or do you feel that Chinese still really bear the responsibility of taking care and providing for their parents and even their grandparents?
The families of elderly are providing substantial assistance, but as the elderly are often remaining in rural areas and their kids are in urban areas and so on, the day-to-day care is not something they can do for the most part. I think China, like many other countries, including Japan, is going to have to move towards institutionalized care for the elderly. At least those institutions are going to have to be available for those who need them, and that also will be costly. But it won't be as costly as one would think looking at current health data on the elderly, because future generations are going to be healthier, longer, and not need as much care.
Ronald Lee, thank you so much for joining us. We appreciate it.
Thank you.